Two nursing students. Same knowledge, same study hours. Normal range for potassium. These are rare on NCLEX. Too easy. Level 2 is comprehension. Number 3. The communication trap. NCLEX loves therapeutic communication, but students pick the nice answer instead of the therapeutic. Less than 135 or greater than 145. Glucose less than 70 or greater than long-standing. Unstable beats stable. Actual beats potential. A patient with new chest pain, which is acute. Options say opposite things, one is probably right. Example: A. Increase fluid intake. B. Maintain current fluid intake. C. Spinach, yes, dark leafy greens. D. Potatoes, yes, especially with skin. E. Chicken breast, no, protein, but not high in potassium. F. White bread, no, processed carbs are low in potassium. Answer: A, B, C, D. Example 3. Further teaching needed. A patient with heart failure states the following. Which statement indicates need for further teaching? A. I weigh myself every morning before breakfast. B. I can drink water whenever I'm thirsty. C. I call my doctor if I gain 3 pounds in a week. D. I take my furosemide in the morning. My thinking process. Looking for the wrong statement. A. Daily weights. Correct. Good practice. B. Drink whenever thirsty. Wrong. Heart failure requires fluid restriction. C. Call if gain 3 pounds. Correct. Sign of fluid retention. D. Furosemide in morning. Correct. Avoids nighttime urination. Answer: B. This shows they don't understand fluid restriction. Example 4. Medication question. A patient is receiving metoprolol. Which finding would cause the nurse to hold the medication? A. Blood pressure 118/76. B. Heart rate 52. C. Respiratory rate 18. D. Temperature 99.2 degrees Fahrenheit. My thinking process. Metoprolol equals beta blocker. That's the olol suffix. Beta blockers lower heart rate and blood pressure. Hold parameters. Usually HR less than 60 or BP less than 90/60. A. BP 118/76. Normal, don't hold. B. HR 52. Below 60, hold the med. C. RR 18. Normal. D. Temp 99.2. Slightly elevated, but not related to beta blocker. Answer: B. Heart rate too low for beta blocker. Example 5. Communication question. A patient says, I'm going to die, aren't I? What is the nurse's best response? A. Don't worry, you're going to be fine. B. Why do you think you're dying? C. Tell me what makes you feel that way. D. Let me get the doctor to talk to you. My thinking process. A. False reassurance, never correct. B. Why questions can sound accusatory, not best. C. Explores feelings therapeutically, best. D. Passing the buck, nurse should address. Answer: C. Most therapeutic response. Before we wrap up, let's talk about the mental game. Stop thinking like a student. Start thinking like a nurse. Students think, what's the right answer? Nurses think, what keeps my patient safest? Students think, what did I memorize about this? Nurses think, what's my priority right now? Students think, this seems too easy. Nurses think, simple is often right. Trust your first instinct. Statistics show your first answer is usually correct. Only change it if you misread the question, have new information, or are absolutely certain. Don't overthink. The NCLEX isn't trying to trick you into failing. They want safe nurses. If an answer keeps the patient safe and makes nursing sense, it's probably right. Read what's there, not what you expect. Don't add information that isn't given. If they don't mention vital signs or abnormal, assume they're normal. Work with what you have. You know more than you think. If you've made it to the NCLEX, you have the knowledge. Trust your training. Trust your instincts. Trust the process. All right, let's recap what you've learned. The NCLEX tests critical thinking, not memorization. Questions follow predictable trap patterns. You now know the 10 most common traps and how to spot them. You have frameworks that beat any question. ABCs, Maslow, safety first. You know how to identify what questions really ask. You have elimination strategies when you're stuck, and you understand the mindset that makes the difference. You now have the blueprint to decode any NCLEX question. This isn't about being smarter, It's about being strategic. Here's your homework. Take 10 practice questions today, but don't just answer them. For each one, identify: what type of question is it? What trap are they using? What framework applies? Do this for 1 week and watch your scores transform. Now, I need your help to keep this channel growing. Like this video if it opened your eyes to how NCLEX questions really work. That like button helps other nursing students find this content. Subscribe to Nursing Simplified and hit the notification bell. We drop new videos every week breaking down the hardest parts of nursing school. Comment below: what NCLEX trick surprised you the most? What question type do you want me to break down next? I read and respond to your comments. Share this video with your study group, your classmates, anyone preparing for the NCLEX. Be the friend who helps them pass. Remember, the NCLEX doesn't determine if you'll be a good nurse. It tests if you can think like one. And after watching this video, you absolutely can. You've got this. The NCLEX has nothing on you now. Keep studying smart, not just hard. This is Nursing Simplified. I'll see you in the next video. Stay strong, future nurse.